Good afternoon and a warm welcome first to our guest of honor, Prof. Sat Koo, as well as fellow colleagues who are here today. Thank you for taking time off this precious Saturday afternoon to be here at the launch of the Clinical Practice Guidelines of Dementia. This is actually organized by the Ministry of Health and co-organized by the College of Family Physicians, as well as the Chapter of Geriatricians and the Chapter of Neurologists, College of Physicians, Academy of Medicine Singapore, as well as the Chapter of Psychiatrists, Academy of Medicine Singapore. As we know, dementia is actually a progressive and degenerative condition that affects memory, thinking, behavior, emotion, and day-to-day functioning. A common definition would be that of evidence of a decline in memory and thinking, which is of a degree sufficient to impair functioning in daily living, usually present for 6 months or more. And the age of onset is usually from 65 years onwards and usually not before 45 years. So this is actually going to be a serious problem with the rapidly growing demographics worldwide. And right now, there are 25 million people who suffer from Alzheimer's disease, which is the most common form of dementia. This will actually increase to 64 million in the year 2030, and it will reach an astounding 114 million by the time we hit 2050. What then is the impact in our local population? Singapore has one of the fastest aging population, and 15 to 20% of total population will be aged more than 65 years by the time we hit 2030, as previously mentioned by Prof. Sat Koo. So looking at this, which is taken from the Access Economic Report, we notice that right now there is about 22,000 people with dementia, and this will increase to 52,000 by the time we hit 2020, and by the time we hit 2050, there will be 187,000 people who will have dementia. But what is the significance? That is because of the burden of disease in dementia. Every year, you will notice that there are 5 million disability-adjusted life years which are lost to dementia. And looking at this, this is even more than breast cancer, rheumatoid arthritis, or even hepatitis B. Thus, evaluation of dementia is important, especially in the early stages, because interventions which are done early will delay progression and subsequently enable individuals who have dementia to function longer in the community and hence delay institutionalization. This has a benefit both on an individual and family level. As you know, more than half the cost of dementia is in informal care. And subsequently, this will also impact on the societal level because of the healthcare expenditure, which is increased with dementia, as well as the opportunity costs, which are actually lost as a result of the caregiver having to care for their family members with dementia. Hence, the guideline aims to share pointers in the evaluation and management of dementia. And since the first guidelines in 2001, several publications as well as research advances have taken place in the area of pharmacology, as well as management of controversies in BPSD management. And these guidelines also include a unique but important aspect of ethical issues in dementia. This set of guidelines have been developed by the various workgroup members in alphabetical order, and we have spent numerous evenings in this very building itself to trash out the various issues in the various aspects, and of course with the help of the editors, Dr. Pui and Dr. Gupta. So first of all, we will actually touch on screening and assessment of dementia to be done by Prof. Kwa, who is actually the head of psychological medicine in NUS. Subsequently, pharmacological management by Dr. Lim Wee Xiong, consultant, Department of Geriatric Medicine, Tan Tock Seng Hospital. Then Dr. Yap Hua Ling, head of Changi General Hospital, psychological department, will just make a short announcement, followed by T. And subsequently, social and caregiver management of dementia, community resources by Dr. Philip Yap, consultant, Department of Geriatric Medicine, Alexandra Hospital, followed by ethical issues in dementia by Dr. Chin Junji, who's the senior consultant, Department of Geriatric Medicine, Tan Tock Seng Hospital. And lastly, but importantly, applications of guidelines in primary care. What is the role of GP in diagnosis and follow-up of dementia by Dr. Tan Kok Leong, who's the director, Sing Health Polyclinic, Outram. So without further ado, please welcome Prof. Kwa to actually give his first part of the guidelines on screening and assessment of dementia.